Lyme disease symptoms. 10 early signs you might miss. Could that unexplained fatigue or that weird rash be something serious? Lyme disease is a tricky illness, and its early Lyme disease symptoms can often be mistaken for other things. This video will highlight 10 crucial early signs of Lyme disease that you might be overlooking. Remember, this information is for educational purposes only and should not replace medical advice. If you suspect you have Lyme disease symptoms, please consult a healthcare professional for proper diagnosis and treatment. The science-backed resources supporting the information presented in this video can be found in the description below. Welcome to our daily health. Lyme disease is caused by bacteria transmitted through the bite of infected black-legged ticks. Recognizing the early signs of Lyme disease is key for timely intervention and better outcomes. These early symptoms of Lyme disease can be subtle and easily dismissed. Let's explore 10 Lyme disease early symptoms you need to be aware of. 1. The classic, but not always present, bullseye rash. One of the most well-known early Lyme disease symptoms is the erythema migrans, EM rash. This distinctive rash often appears at the site of the tick bite within 3 to 30 days. It's frequently described as a bullseye, with a central red spot surrounded by a clear ring and an outer red circle. However, not everyone with Lyme disease develops this rash. Some people may have a rash that looks different, or no rash at all. So, while the bullseye rash is a significant early sign of Lyme disease, its absence doesn't rule out infection. Tip: carefully examine your skin after spending time outdoors, even if you don't recall a tick bite. Look for any unusual rashes, not just the classic bullseye, as variations can occur. 2. Unexplained fatigue that goes beyond tiredness. Feeling tired after a long day is normal, but the fatigue associated with early Lyme disease symptoms is often profound and persistent. It's not just feeling a little sleepy, it's an overwhelming exhaustion that doesn't improve with rest. This Lyme disease fatigue can interfere with daily activities and feel disproportionate to any exertion. If you experience significant, unexplained fatigue, especially after potential tick exposure, it could be an early sign of Lyme disease. Tip: pay attention to the intensity and duration of your fatigue. If it's debilitating and lasts for more than a few days without a clear cause, consider the possibility of early Lyme disease. 3. Flu-like symptoms, fever, chills, and body aches. In the initial stages, Lyme disease symptoms can mimic the flu. You might experience fever, chills, muscle aches, and joint pain. These early Lyme disease symptoms can be easily dismissed as a common viral infection. However, if these flu-like symptoms occur during the spring or summer months, when ticks are most active, and especially if you recall a tick bite or live in an area known for Lyme disease, it's important to consider Lyme disease as a possibility. Tip: consider the timing of your flu-like symptoms. If they appear after spending time outdoors in tick-prone areas, be sure to mention this to your doctor. Found this video valuable? Like and subscribe for more health tips. Drop your comments or questions below. We're eager to hear from you. Please share this video to help others. 4. Headaches that can be severe and persistent. Headaches are common, but the headaches associated with early Lyme disease symptoms can be quite severe and persistent. They might feel different from your typical tension headache and can be accompanied by other early signs of Lyme disease like neck stiffness or fatigue. If you experience a new, persistent, and severe headache, especially with other flu-like symptoms or after potential tick exposure, it's worth considering Lyme disease as a potential cause. Tip: note the characteristics of your headache. Is it unusually severe? Is it accompanied by other symptoms like neck pain or sensitivity to light? 5. Joint pain and swelling that can migrate. One of the more subtle early Lyme disease symptoms is joint pain. This isn't always the severe, debilitating arthritis seen in later stages. Instead, it might start as mild achy pain in one or a few joints. And what's characteristic of Lyme disease joint pain is that it can migrate from one joint to another. You might have pain in your knee one day and then your elbow the next. This migrating joint pain, especially when accompanied by other early signs of Lyme disease, should raise suspicion. Tip: keep track of which joints are affected and whether the pain seems to move around. This pattern of migrating joint pain is a key clue. 6. Neck stiffness and pain. Similar to headaches, neck stiffness and pain can be an early Lyme disease symptom. This stiffness might make it difficult to move your neck and can sometimes be accompanied by a headache. While neck stiffness can have many causes, if it occurs alongside other potential early signs of Lyme disease, particularly after a possible tick bite, it warrants attention. Tip: try to recall if your neck stiffness started gradually or suddenly. If it's accompanied by other symptoms like fever or headache, inform your doctor. 7. Muscle aches and pains, myalgia. Widespread muscle aches and pains, or myalgia, are another common early Lyme disease symptom. These aches can feel similar to those you experience during the flu, but might be more persistent or severe. If you experience significant muscle aches, especially in conjunction with other early signs of Lyme disease and a history of potential tick exposure, it's important to consider Lyme disease as a possible cause. Tip: differentiate Lyme disease muscle aches from typical post-exercise soreness. The pain associated with Lyme disease often appears without a clear physical exertion. 8. Swollen lymph nodes. Swollen lymph nodes are part of the body's immune response to infection. In the early stages of Lyme disease, you might notice swollen lymph nodes, particularly near the site of the tick bite. These swollen glands might feel tender to the touch. While swollen lymph nodes can occur with various infections, their presence alongside other potential early Lyme disease symptoms should prompt consideration of Lyme disease. Tip: gently feel the lymph nodes in your neck, armpits, and groin. If you notice any new swelling or tenderness, especially with other early Lyme disease symptoms, bring it to your doctor's attention. 9. Facial palsy or Bell's palsy. Although less common as an initial symptom, facial palsy, also known as Bell's palsy, can occur as an early Lyme disease symptom. This involves a sudden weakness or paralysis of the muscles on one side of the face, causing drooping. While Bell's palsy has other causes, it's important to consider Lyme disease if it develops, especially if other early signs of Lyme disease are present or if you have a history of potential tick exposure. Tip: if you experience sudden weakness or drooping on one side of your face, seek medical attention immediately. While it could be Bell's palsy from another cause, Lyme disease needs to be ruled out. 10. Changes in vision. Some individuals with early Lyme disease symptoms report changes in their vision. These can include blurry vision, double vision, or eye pain. While eye problems are not the most common early signs of Lyme disease, their occurrence, especially alongside other suggestive symptoms and a history of potential tick exposure, should not be ignored. Tip: pay attention to any new or unusual changes in your vision. If they are accompanied by other early Lyme disease symptoms, inform your healthcare provider. Bottom line: recognizing these 10 early signs of Lyme disease is crucial for seeking prompt medical attention. Early diagnosis and treatment with antibiotics can significantly improve outcomes and prevent the development of more severe, late-stage Lyme disease symptoms. If you experience any of these early symptoms of Lyme disease, especially after a tick bite or in an area where Lyme disease is prevalent, consult your doctor for testing and guidance. Remember, early detection is key to managing Lyme disease effectively.